I'm Bill Morris. I'm a clinical nutritionist and a pharmacist. And we deal here at the store helping to treat people holistically. We look at the whole person, and also functional medicine. In other words, trying to get to the root cause and not just treat the symptom. Now I want to talk to people who have gastrointestinal issues. If you have problems with constipation on a regular basis, you have intermittent problems of diarrhea and constipation, or just diarrhea alone. I'm talking to people who have irritable bowel syndrome. I'm talking to people who have Crohn's disease, who have diverticulitis or diverticulosis, who have ulcerative colitis. I'm not saying that we can cure that. We can make your quality of life of something as simple as just going out to eat with family or friends at a restaurant and not having to have memorized in every restaurant in town where the bathroom is in case you have to get there quick. I understand that. What do I do? What are some of the treatments that I do to help you with these symptoms? All I really do is just feed the body's system. The body wants to be in a state of health. It will make you healthy as best it can if it's got what it needs, given it through our diet and the nutrients we take. So number one, the first thing I do is probiotics. We hear a lot about probiotics today. They everywhere you look, in magazines and TV and everything. Probiotics mean that they are good bacteria. They're friendly bacteria. They are all over our body, but mainly in the small and large intestine, Lactobacillus acidophilus in the small intestine, Bifidobacterium in the large intestine. Now we have many different strains of these organisms in the body, as many as 400 different strains, and we have almost 4 to 5 pounds of good bacteria in the gut. So probiotics, they have 70% of your immune system, and with something like the ulcerative colitis and really a lot of everything we do, immune system is crucial. That's one of the things we're trying to fight is inflammation and the immune system and help keep it good and strong. When you have a problem with yeast, we have problems with candida, we have problems with parasites, we have problems with worms, we have undigested food particles getting into our blood. We're having problems with the intestinal permeability membrane. This is really about the membrane of your eyelid, protecting your body from first invaders that come through. And that's set up to where the really micro size particles of food can get through this barrier after the digestion process, if it's done right, is done, and the larger molecules that we've just talked about, a lot of the bacteria and undigested food or whatever would just pass on and go out through the gut. This is called dysbiosis. It's a combination of where there's no synergy. They're working against each other. You're trying to treat a surface area about the size of a tennis court. It takes almost 6 weeks of taking almost 30 billion and the strength of a probiotic to colonize the surface of the GI tract. And what we're trying to do, if this piece of paper, this piece of paper is the size of your GI tract, we're trying to get every little thing on this page covered as much as we can with friendly bacteria. So there's not as much room for candida and yeast and the other things I've talked about to even get on the surface. This keeps the patches up the roads. The road that has is the road that has a hole in it like a highway. What we want to do is to plug those up and make sure that food is getting like it's supposed to, and the dysbiosis is not going on. So when I'm treating somebody, you'll find that has constipation, and you start taking probiotics, let's say 75% of the time, just with that alone, the constipation starts to clear up by the first bottle. Same thing with diarrhea. If you're taking an antibiotic, You need to take probiotics because the probiotics kill good bacteria and bad and can cause the dysbiosis that I'm talking about. But this is the food that I'm talking about first in treating any kind of GI issue. Number 2, I use digestive enzymes that are helping you do the work that your body should be doing, but we're going to make sure it's getting a lot of it done. We do enzymes for proteins, carbohydrates, and fats. Most of the time, the people I'm dealing with these issues that we've talked about in their gut, they have inflammation and some gastritis, maybe even have GERD or gastroesophageal reflux disease. So in this product, it's called Similase for sensitive stomachs. It has slippery elm and marshmallow root, kind of like the emulsant that's covering the skin and the tissue of the gut. This also has deglycerized licorice in it, and it helps to calm down a tummy. So if you have irritable bowel syndrome, probably have the gastritis. So we're using a probiotic, the Similase to start to help. And then you've got to get fiber. The fiber that we use is not Metamucil, which is a refined psyllium product. We use something that's got ground flaxseed. It's designed by a company that does nothing but intestinal products. All they do is that. And they're finding that when you use psyllium or even use the perfect psyllium that you can get from good fiber intake, that scrubs the gut. The flaxseed, and sometimes with irritable bowel, ulcerative colitis, Crohn's disease, your gut cannot take it. The tissue is too inflamed. It's kind of like trying to put out many fires that are in our gut. So when we do the flaxseed oil and flaxseed, it helps in decreasing inflammation. It's an anti-inflammatory. We also use slippery elm and marshmallow root in this product, and it has other fibers that help to make sure that we're feeding the lining of the gut, and the lining of the gut replaces itself every 3 to 5 days. It's some of the fastest growing organisms in the body. So when you do these things, it has L-glutamine. It feeds those cells. That's the fuel which helps them to turn over and grow fast. Last thing I'll probably use many times is aloe vera juice. I use a very pure leaf of the aloe plant, 99.5% pure, and you use 1 capful. This is one thing you need to keep in the refrigerator. Our probiotics are alive. They need to be kept in the refrigerator. You do a capful 3 times a day. In a perfect world, it would be at 9:30, 3:30, and 9:30 p.m. But keep it away from food, either an hour before meals, 2 hours after meal. Extremely good for GERD or gastroesophageal reflux. But what we're trying to do is to cut down the redness, the erythema that you're getting from these conditions where the body's inflamed. Thank you very much.